So in today's course, Dr. Wu will explain how S5 allows accurate adjustment of the position of the rotation center for each tooth according to the position of the root displayed by CBCT and to achieve more accurate root control movement, solving or avoiding bone fenestration in short term. We have set aside some time for Q&A for you with Dr. Wu by the end of this lecture. So if you have any questions, please save them and type them in the Q&A box at the end of the session. Subtitles are available by clicking on Live Transcript at the bottom of the Zoom window and choosing Show Subtitles. Please select the language according to your preference. So now let's welcome Dr. Wu to share his ideas on the topic, Application of Intelligent Rotation Center, S5 in Clinical Cases in Orthodontic Clinical Treatment. Dr. Wu.
Okay, thank you for introduction. And let me talk about S5 technique. So I'm very glad to meet you in the internet. I'm very lucky to have the technique to share with you. First, let me introduce briefly what is S5. Let's look at a video first.
The movement of the tooth in orthodontic treatment is achieved by the application of orthodontic force. The ideal orthodontic force is achieved through the force of the resistance center. When the force line of the orthodontic force passes through the resistance center of the tooth performs a translational movement. However, in the actual clinical operation, the orthodontic force acts on the crown, and the orthodontic force line cannot directly pass through the resistance center to rotate teeth. According to the actual condition of the tooth, the doctor can move the tooth by applying force and torque to the tooth. The movement mode of the tooth is affected by the ratio between torque and force. At low torque, the rotation center of the tooth, is located closer to the tooth root than the resistance center. At medium torque, it will cause the translation of the tooth, and the rotation center is located at infinity. At high torque, the rotation center is located closer to the crown than the resistance center. The precise control of the center of rotation not only makes precise tooth movement possible, but also avoids bone fenestration and bone dehiscence caused by improper tooth movement, thus achieving the best treatment effect. For anterior teeth with thin labial mucous membrane wall, the proportion of positive torque needs to be applied. The intelligent rotation center can be placed at the cervical area of the labial side tooth to control the crown's rotation and simultaneously move the root into the alveolar bone. This method can be safely and effectively used to apply torque control and anterior tooth intrusion and reduce the difficulty of orthodontic treatment for some deep overbite cases. In different cases, the application of the intelligent rotation center varies. For anterior crossbite correction using clear aligners, it often requires proclination and intrusion. At this time, the intelligent rotation center can be placed in the resistance center, which is towards the root, and is suitable for anterior crossbite cases where the labial side bone wall is thick. With the rotation center close to the incisal edge, it can reduce the relative intrusion, and vice versa. When relieving anterior crossbite using traditional fixed orthodontics, during the anterior proclination after leveling the occlusal plane, anterior extrusion is inevitable because the arch wire controls the vertical dimension of the crown. Through invisible clear aligner treatment, there's a significant relative intrusion on the anterior teeth during proclination, which helps to relieve the anterior teeth crossbite of patients in the early stage of orthodontic treatment to avoid occlusal trauma and reduce discomfort during chewing.
Okay. So that's the quite key point of the S5 technique. So maybe someone could not understand it totally. So now I will take an hour to explain it in detailing. So the first question we should think about is the how to control the anterior torque expression in fixed orthodontics. Yes, of course, most of us are doing fixed orthodontics, are doing fixed braces. But how to control the torque expression in fixed braces? Let us think about it. Look at the picture, how we could control the torque. First of all, we put braces on the tooth on a certain position. The position is quite precise. We need to put it in at a certain position. And then we bend the wires to express torque. So there's two keys in fixed orthodontics in torque expression is first, put the position, we put braces, and second, we bend wires. So that's 2 points. But it's different, it's quite different in visible orthodontics. Why? Because of first reason is the feathers of aligners. Because the inner surface of the clear aligners fits the crown of tooth, exerting force on the tooth in 3 dimensions from the very, very first set of aligners. It's quite different from the braces. Braces, we put the wire from very thin wire to the rectangular wire, so step by step. But in aligners, the very first aligners, we could exert the force on the tooth in 3 dimensions. That's quite different. And the second difference is the feathers of animation design. Those animation design, maybe many doctors have not seen any, do not know any animation design, but I will tell you something about animation design in Smartee. First of all, we should review the basic knowledge of the centers. 2 centers in orthodontic mechanics. The first sentence is the resistance center. What is resistance center? That's a point, an object, or a tool at which a single force is applied to produce a translation. It's quite similar to the center of mass. That's resistance center. And another center is rotation center. What is rotation center? It's a point around which an object rotates under the action of an external force, which changes with 3 factors, which changes with the magnitude of the external force and the direction of the action and the position of the point of action. So we know that the rotation center differs from the forces with the magnitude and the direction and the position. So it's quite complicated effect. Yeah. And in aligner and braces, they are quite different expression. Okay. Let's see another 2 limits of anterior teeth movement. One is tipping, totally tipping. Rotation center, when we put the rotation center in the root app, so there's totally tipping. And if we put the rotation center at the edge of the crown, it become a totally root control. We achieve those 2 limits quite different in brace and aligner. Look at the last, look at here. In the lower and the right side, they're different from orthodontic force and the rotation center. In fixed braces, we put orthodontic force. Then we achieve rotation center. But in invisible orthodontics, it's quite different. In the rotation center, first, we point out the rotation center in the animation design in the computer, and then we, with the aligner, put on the tooth, the orthodontic force is coming. So we have rotation center, then we have orthodontic force. It's quite different with fixed orthodontics and invisible orthodontics in the movement of the anterior tooth. Let me explain more about it. In the animation design, the rotation center can move freely, and it can move everywhere. You can see the animation. We can put the rotation center at the gingival margin. Okay. Anywhere in the space in the design. So the different rotation center achieve different tooth movement. It's quite easy to understand. And then different rotation center achieve different tooth movement because of the different position. The rotation is quite different. Different tooth movement effects can be obtained by adjusting the position of the rotation center. So the two animation can tell you the difference. So now we know there are two important parameters for anterior tooth torque control in visible correction. One is rotation center. The other is rotation angle. It's quite similar with the fixed orthodontics, how to control the torque. The fixed orthodontics, the position of the braces and the band, the angle of the wire is there are two important keys, and in aligners, rotation center and rotation angle are two important parameters. So that's different. So how to use the idea of rotation center in clinic? Now I will give you some examples. First example is a case of a deep overbite. Look at the picture, the intraoral picture. Very rich gland up in front teeth and mild crowding and the deep overbite. This is quite a complicated case, but today I just talk about the torque control of up front teeth. So talk about the upper front teeth control, we should look at the CBCT. This is pre-treatment CT. We can find that the labial bone plate of the upper anterior teeth is quite thin. It's thin just like paper. So it's quite dangerous in the clinic if we take some inappropriate force to the anterior teeth. Maybe the bone is broken, and maybe we have frustrated the bone, and the relationship between the bone and the root is broken. So it's quite dangerous in the upfront teeth. So how can we do with aligners to protect the bone and to prevent the root from broken from the bone? So it's a very interesting thing for us. So this is what we do. The left and the right side are two types of animation. The left side animation, we put, you can see the rotation center. We put the rotation center on the just almost at the resistance center. maybe somewhere like this, a resistance center. And the left animation, we put a rotation center at the gingival margin. So which one could we choose? The left one or the right one? Of course, we choose the right one. Why we choose the right one? Because in the right animation design, we preclined the crown. Of course, we preclined the crown. And because the rotation center is at the gingival margin, so the root must rotate to the palatal side. So could you imagine that? We put the rotation center at the gingival margin so as to make the root far from the bone wall. Okay, so that's in our pictures, generally the orthodontic treatment. Stage 0 at the very first beginning, we could see the very deep overbite and the retroclined up fronties and the mouth crowding. And the stage 7, a little better. Stage 15, and at last, stage 28, the deep overbite is quite improved, and the retroclined up in front, retroclined upper anteriorities are quite up straight. So it seemed the up front is controlled quite good. It's quite good. But is it really quite good? What about the relationship between the bone and the root? So we need to take CT scan to examine it. So that's the CT scan we take at the very first beginning, and at the stage 7, and at the stage 28. So there are 4 up anteriorities. From the CT scan, we can see that the bone and the root relationship is getting better and better. And at the same time, we just see so the deep overbite is quite improved. So when the root rotate clockwise, and simultaneously, the up front is intruded. Yes, of course, they intruded so as to solve the deep overbite. But when the up front is intruding, does the bone have any resorption? Does the bone resorption is physiologically or pathologically? So we need to do some measurement. We measure what? We measure the distance between the alveolar crest to the CEJ, segmental enamel junction. The distance we measured at each CT, and we calculate. We found that there's no different height with the three stages. So it's quite physiological. So we use the S5 technique and we get a good result. Now, could you imagine if you use braces, could you get the same good result as this one? Maybe not. And this is the animation and the really real step. Okay, the left is the treatment plan, the treatment design. The green is the step 28, and the blue is in initial time. And the right, the blue is the initial time, and the green is the rarely stage 28. The digital cast dental model, we take a superimpression and we compared with the design and the actual situation. We found that it's almost the same. So I conclude that the aligner, that the Smartee aligner, give a quite good control of the up front teeth. So now another case, another quite interesting case. Okay. So this patient is, of course, still a deep overbite, but this case is quite interesting because the patient's teeth is extracted before orthodontics. The patient was extracted upper second premolars, two upper second premolars, and then do braces. And at a quite early stage of braces, a doctor used elastics to pull the upper anterior teeth back in thin wires. So that's quite dangerous. Of course, that's quite dangerous. So there's problem. Okay, this is the before treatment. This is before treatment stage scan. We can see the bone is quite thin, but the root is still in the bone. But after 3 months of fixed braces, what can we see? Because the doctor used the incorrect force to pull back up on upper anterior teeth. And the teeth rotate, the crown reclined, and the roots broke out of the bone. Every teeth is terrible in the front 6 teeth there. So the patient felt quite sensitive to heat and cold. So immediately, the patient come to me and I take off braces immediately. And everyone can see the in the picture, the patient's upper second upper molar, the 2 premolars are gone. So it's quite pity. And of course, there are then mini screws there. Before the doctor put the first doctor put the braces on the teeth and implant 2 mini screws, and at the first, just very early stage, use elastics from the mini screw to the braces, so the bone and the root relationship is broken. So what shall we do now? So what shall we do? Of course, the patient come to me and I use Smartee S5 technique to help her to solve problems. Okay, this is the animation design. The animation design, in the animation design, we put the rotation center at where the 6 upper front teeth, we all put the rotation center at the gingival margin and the crown margin. So when the crown recline, the root must come back to the bone. So what did happen? This is the animation design. I designed 15 stages of animation to move roots back to the bone. This is the design, and let's take a look at the result. So this is the first slide is before the starting fixed orthodontics. The bone and the root relationship is quite good. And after 3 months of fixed braces, anterior teeth are quite sensitive to cold and heat. The roots broken out from the bone. And then I gave her Smartee S5 treatment. And after 7 months, the patient felt better of the sensitivity of cold and heat. And the dental pulp is quite good. It's quite healthy again. So we can find that the roots are already back to the bone. And 2 months later, the root and the bone relationship is completely back to normal. So only Smartee S5 can help us to get the teeth back, to get the bone back, and to get the dental pulps back. The pulps are all active, are all alive. We do not need any root canal treatment. No root canal treatment. They are alive. So do you think it's amazing or not? If you think it's amazing, you just use S5. You just tell us, well, you should put the rotation center. Where to put the rotation center? You tell us, and we can help you to get these results. And what's more, we take a look at the third case. I think it's more complicated because the anterior teeth mobility is 30 degree. Yes, 30 degree is enough. It's the mobility is too much. So we need to put it out. But the patient refused to pull out the teeth or pull out the teeth because he want to save them. Let us see if it could be possible. So this is a patient about almost 40s, in his 40s. And then this is first picture at the very first slide. We can see the upper incisors. There are quite a big space here. Look at the other picture at the first visit. Very big space between the two upper incisors. And what's more, we can find the reason repairing between the incisors. So we can imagine the process of the patient, the tooth movement. At first time, maybe there are quite small space, and the patient repair the space with the resins. But unfortunately, gradually, the upfront teeth are getting more space here. So they moved a lot of distance. And in the OPG, we found that there are almost, the two teeth have almost no bones around them. third-degree mobility. And the CT scan tell us, of course, the 11 and the 21 teeth, the two up front incisors could not survive. They must be put out. And then we will do implant. That's the correct way to treat the patients in the common view. But if the patient said, I want to save my teeth, could you help me? Could you help you? Could you help him? When the patient come to me, I said, yes, maybe let me try. Let me try to save your teeth. So what can I do now? What can I do first? Of course, first of all, we need the root canal treatment of the 21 incisors, because the pump is not so active, so we need to root canal treatment. And then we make the animation design. This is the initial animation design. So is it possible? Is it possible? Everyone may think about it. Everyone may think it's so doubtful. Maybe it's not impossible. But what I did is that first I tell the company, I tell Smartee, the well is the rotation center. You can see the red point is the rotation center. Why did I put the rotation center here? Because first I wanted the teeth rotate with the right point to make sure the root is at the center of the bone graft. And then I intrude the two teeth to improve deep overbite. So that's the plan. And this is the result. What is result? The deep overbite is quite improved. And what's the result? Its result is the 19 plus 10 stage. Why is 19 plus 10? During the first 19 stages, we closed the space, the upper incisor space. And then we remove the resin between the teeth and make a refinement. And we do additional 10 stages to close the additional space without resins. So we take 19 plus 10 stages to close the upper incisor space and intrude the incisors. So what's about the mobility of the incisors? Is there still third degree? Look at the picture. This is the stage 19 plus 10. After 29 stages, we put the up front teeth into the bone, and the new bone formation is obvious in the CT scan. And the mobility of the incisors is, of course, is no more 30 degree. It's less than 1 degree. Yeah, let's take a look at the one stage before and the after. Could you imagine it? Could you imagine the result before treatment? No, I think no one could imagine the result except me, because I did it. Why I can do it? Because I trust Smartee. Because I'm the Smartee. I'm the Smartee boy. Yes, thank you. Because the Smartee could let me do it. So we get a good result. And the patient is very thankful to us. Okay. Okay, that's the 3 cases of about the procrastination and the intruding of the facial pregnant patients. And now I talk about another aspect of the S5. So this picture showed us the feathers of anterior procrastination with fixed orthodontics. What's the feathers? When we proclined the up anterior teeth, we not only do proclination, but also do extrusion. Also extrusion. So because of the wide embraces. So it's quite different in aligners. Maybe it's not so easy to understand. So let's take an example, a simple case. Let's look at a quite simple case to see what's the difference. The proclination of anterior teeth with the aligners and the fixed braces. This is a quite simple case. We need to procline the lateral incisor, upper lateral incisors, and retract central incisors. This is the OPG. So that's animation. Proclination of the lateral incisors and the retroclination of the central incisors. With the proclination of the lateral incisors, we find that the maxillary lateral incisors do not fit the applies, but the rest of the teeth fitted so well. So why? What's the problem? Why only 2 teeth are not fitted so well? Because of what? Because with the proclination of the crown is relatively intruded. Because the lateral incisors, they do not have any attachment. So the aligner could not put them down to fit the aligners. So that's the reason. And this case is quite simple. We can solve it with elastics, with buttons and elastics. It's quite easy to solve these problems in this case. But this gives us an idea in the treatment of crossbite. So This is key point. This is one of the key point. Okay, up incisors preclination, generating the intrusion, which is benefit for reducing the occlusion interference. So it's quite different from the fixed orthodontics. So we can use the feathers to solve problems, to solve the crossbite problems. Yeah, it's also it's just the same principle with the previous cases. So we also consider the relationship between the rotation center position and the relative intrusion. Rotation center position and the relative intrusion is quite interesting. So I will show you a case of crossbite. So this female about 50s, in his 50s, we use Smartee invisible orthodontics. It's quite complicated cases if we take a first look at the front teeth, crowding, and crossbite, and crossbite. And this is self and the OPG. The AMB angle is negative 1.2. And the pre-treatment CT scan showed that the maxillary lateral incisors were still quite reclined. And the labial planes of the mandibular central incisors were quite thin. So this is the treatment stage, or I time limited, I ignore it. This is admission design. We pull out the one mandibular incisor, and we do expansion. We take molar distalization, and most important, we preclined the two lateral incisors. But is there any interference with the upper and the lower dentition? This is the first this first stage of the animation. Stage 1, stage 0, and stage 24 animation design. In this animation, we preclined the up in front teeth, and we did not put any attachment on the on the surface. So when we preclined the up front teeth, they have a relatively intrusion effect. So the liners did not fit so well. And the refinement, in the refinement, you can see the upper lateral incisors preclination. Did they have any interference with the lower dentition? Let me check. This is the 9th stage. The lateral incisors reached the edge-to-edge relationship, and at the same time, the lower anterior teeth are quite aligned, but there's no interference. And almost the 18th, there's some mistake. The 18th set of the first refinement, the lateral incisor crossbite released, and it also have a tendency of open bite. Lower anterior teeth align is very good. So the lateral incisor from crossbite to open bite, and no interference. So this is there's no occlusion interference there in the release of the lateral incisor crossbite. So could you imagine it? And the second time refinement, of course, it's quite simple now, no interference. So this is the second refinement, the 16th set of the second refinement. Lateral incisor became the open bite from deep coarse bite to open bite. Why? Why? Because with the perclination, they have a relatively intrusive effect. So that's comparing with the before and the after comparison of the separation. We can see with perclination, actually, we intruded the upfront teeth quite a lot, so they can correct from the crossbite without any interference. So that's quite interesting too. The upper teeth were relatively intruded due to perclination. So that's the result. That's the comparison, perfect contrast of the before and after. And the AMB angle is improved much. And at the same time, let me examine the changes of maxillary lateral incisor stalk and alveolar bone with the help of Smartee aligners. We get a quite good result. The bone and the root relationship is quite good of the maxillary lateral incisors. This is the rotation center at the first design, the first refinement, the second refinement, and the third refinement. And this is the results of the patient. So at the end of my lecture, let me show you the video again. It's quite important.
The movement of the tooth in orthodontic treatment is achieved by the application of orthodontic force. The ideal orthodontic force is achieved through the force of the resistance center. When the force line of the orthodontic force passes through the resistance center of the tooth performs a translational movement. However, in the actual clinical operation, the orthodontic force acts on the crown, and the orthodontic force line cannot directly pass through the resistance center to rotate teeth. According to the actual condition of the tooth, the doctor can move the tooth by applying force and torque to the tooth. The movement mode of the tooth is affected by the ratio between torque and force. At low torque, the rotation center of the tooth, is located closer to the tooth root than the resistance center. At medium torque, it will cause the translation of the tooth, and the rotation center is located at infinity. At high torque, the rotation center is located closer to the crown than the resistance center. The precise control of the center of rotation not only makes precise tooth movement possible, but also avoids bone fenestration and bone dehiscence caused by improper tooth movement, thus achieving the best treatment effect. For anterior teeth with thin labial mucous membrane wall, the proportion of positive torque needs to be applied. The intelligent rotation center can be placed at the cervical area of the labial side tooth to control the crown's rotation and simultaneously move the root into the alveolar bone. This method can be safely and effectively used to apply torque control and anterior tooth intrusion and reduce the difficulty of orthodontic treatment for some deep overbite cases. In different cases, the application of the intelligent rotation center varies. For anterior crossbite correction using clear aligners, it often requires proclination and intrusion. At this time, the intelligent rotation center can be placed in the resistance center, which is towards the root, and is suitable for anterior crossbite cases where the labial side bone wall is thick with the rotation center close to the incisal edge, it can reduce the relative intrusion, and vice versa. When relieving anterior crossbite using traditional fixed orthodontics, during the anterior proclination after leveling the occlusal plane, anterior extrusion is inevitable because the arch wire controls the vertical dimension of the crown. Through invisible clear aligner treatment, there's a significant relative intrusion on the anterior teeth during proclination, which helps to relieve the anterior teeth crossbite of patients in the early stage of orthodontic treatment to avoid occlusal trauma and reduce discomfort during chewing.
Okay, that's the lecture. So thank you for listening.
All right, thank you, Dr. Wu, for your presentation. And now it's time for Q&A. Did you use attachment to apply torque?
No, absolutely. I don't need attachment. And I think there's no need to use attachment. We need to totally wrap the teeth to take force. That's more important than attachment.
All right, one more in the Q&A session, Dr. Wu. So he asked, is the lecture available through? Okay, so yeah, the lecture will be on our YouTube channel. You can maybe see it in 1 day or 2. You can search Smartee Clear Aligner and you will find our YouTube channel. Also, our previous webinar sessions are also available on our YouTube channel if you want to review as well. Yes, so you can see our various social media accounts in the chat box, Instagram, Facebook, LinkedIn, and YouTube. And one question, Dr. Wu. So he asks, asks, how much degrees for every aligner are necessary to move incisor?
It's not so difficult. It's not special. It's just in the principle of Smartee design principle. It's quite normal. So actually the exactly number, the exact data I couldn't I just forgot the exact number, but it's not quite special. It's just the same with any other teeth movement. It's no special. Okay.
One more question, Dr. Wu. Do we have to ask something special to technician?
Yeah, of course. We need to tell the technician, well, we want to put the rotation center on. Well, the exact position, the rotation center. Where is the rotation center? You must tell the technician.
All right, so I guess that's all the questions for today. Thank you, Dr. Wu.
Thank you all. Thank you.
All right, so but before we finish today, I'd like to share with you our next few sessions. So those are our upcoming sections in the next 2 months by the end of this year, featuring brought by Dr. Chris, Dr. Anus, Dr. Jiang, and Dr. Wang as well. And so if you want to know more about the webinar and also Smartee, please follow us on our social accounts, such as Facebook, LinkedIn, Instagram, and YouTube. All right, so this is all for today.